I think the data speaks for to the severity of the attacks, which we've never talked before in our previous Apex study, and the reductions were significant. So basically, for example, baseline median attack rate was almost 1, and then went down to almost 0 for moderate and severe attacks. So the reductions in the severity were significant. Yeah, that's correct. So again, data very encouraging, and what it did show that patients during the trial on berotralstat had less days, less symptomatic days. Therefore, they were able to have normal lives. Sort of, they were able to participate during school and after school activities. So yeah, so there was significant improvement in quality of life for those patients and their families. And I personally witnessed myself. So it's the treatment transformed lives of many patients taking part in the trial. Yes, so this is the first and the only oral medication for children with HAE for less than 12 years of age. So it's of course, it has to be discussion between the clinicians and the patients and the parents. So, but this is non-injectable drug, and as most of the pediatricians and clinicians know, children don't like needles. So, currently we have got only one injectable drug, which is injected under the skin every 2 to 4 weeks. And otherwise there are no oral options, and as I mentioned, so children don't like injections, so hopefully the oral formulation will help the children and the families to better and easier manage the disease. Yeah. So what the data showed that the drug was very safe and very well tolerated. There were no grade 3 and 4 side effects induced by the drug. There were no cases needed to stop the medication because of the side effects. So basically, it was very safe and again very well tolerated. So the drug comes in a form of pellets, so can be taken with food very easily. So yeah, no problems with tolerability as well. So safe and well tolerated. So it should improve. So it should improve the adherence to the treatment, reduce anxiety, improve the quality of life for the whole family. So it will be easier to administer and should be able to normalize patients and the families' lives.